Safe patient handling for caregivers. My name is Kari Webb. I am a registered nurse with my associate's degree in nursing. In this presentation, we're going to go over research on the topic of safe patient handling for healthcare workers and caregivers. We'll also talk about how safe patient handling can prevent injuries of caregivers and how healthcare workers and caregivers should be educated on how to handle patients safely to prevent these injuries. According to the Occupational Safety and Health Administration, one of the main sources of injury in healthcare workers is musculoskeletal disorders, and these disorders occur due to patient handling and unsafe patient handling. Out of 973 healthcare workers who took a survey, 59.6% had past musculoskeletal disorders from patient handling in their workplace. Less than half of the healthcare workers stated that the patient handling equipment was not readily available to them. It is important that healthcare workers and caregivers have the proper resources to handle patients safely and avoid injury, including the proper equipment and the proper education. I did my literature search by using Google to find quantitative studies on the issue of musculoskeletal disorders in healthcare workers related to patient handling. I would search topics such as safe patient handling and ways to prevent these injuries in healthcare workers. I narrowed down my research to 3 sources based off of how relevant they were, so if they were newer sources less than 5 years old, and how much they related to my issue of injuries in healthcare workers due to unsafe patient handling. I also chose sources that focused on ways to prevent these injuries. My first article was a quantitative and qualitative quasi-experimental study. It was a level 6 on the hierarchy of research evidence because it lacks a control group and randomization. This study focuses on an app that was created to educate community healthcare workers about safe patient handling, and it focuses on the feasibility and acceptability of this app. The results of the study show that 28 participants thought the app exceeded the criteria for recruitment, retention, and satisfaction. These were the qualitative feedback descriptors. My second article was a quantitative descriptive study, and it was also a level 6 on the hierarchy of research evidence. This study focuses on the education given in higher education institutions in Europe on patient handling. This study gave a questionnaire, a Webb questionnaire, to healthcare professionals in Europe, and 68.4% of the respondents of this questionnaire stated that they have the proper framework to guide patient handling education. That basically comes to show that there is not the proper guidelines for patient handling education in this country. My third article was a non-experimental correlation study, and it was a level 4 on the hierarchy of research evidence. The study focuses on the prevalence of lower back pain in Czech registered nurses and the use of patient handling equipment. It was a cross-sectional survey distributed to 1,460 random nurses, and of that 1,460, only 569 nurses completed the survey, and 84.7% of them stated that they had work-related lower back pain. These studies all come together to show the importance of safe patient handling in the healthcare field and how we can prevent injuries from happening to healthcare workers and caregivers if we practice safe patient handling. One focuses on a way to provide good education on patient handling through an app. The second source focuses on the lack of education that has been given. And the third source focuses on data from actual nurses working in the field on their experience with pain and injuries due to patient handling in the field. In conclusion, it is important as healthcare workers to make sure we know the proper way to handle patients to avoid injuries. Not only is it important to avoid injuries, but it is also important to prevent strain on our body that could cause health issues in the future. In the future, when researching this topic, I think I would look more for sources that focus on the evidence of the healthcare workers, like the last study where it went over data with real nurses and what they go through. I think more sources like that would be helpful for good evidence. And I also would want to look more at the success rate of solutions. The study that was about an app that was created on safe patient handling education was great, but it did not test the success rate of this app and if it actually helped reduce the amount of injuries occurring with healthcare workers.